ask you to watch this stage for what's coming up next. I promise you, you wouldn't want to miss this. So joining us for this next segment and address and of course also demonstration is Nirav Panchal from Kody Technolab Limited. He's the Chief Marketing Officer there. Welcome, Mr. Panchal. Thank you for being with us. And also joining us is Nitin Guru, founder and CEO RX1 Private Limited. Let's hear it for them. And I'm sure you're intrigued as to what suddenly come on stage with them as well. I didn't introduce that. I'll leave that to the two of them.
Good evening, everyone. I want to thank Kartikeji for the invitation. A lot has been said since past couple of days and even in the earlier sessions about health tech, AI, and I want to take the same conversation a little bit forward. I want to begin with a simple thought, and it's a precursor before we talk about AI. I want to talk about the health infrastructure first. Health infrastructure is not judged on its best day, it is judged on its busiest day. It is judged when there are long queues, when medical staff are stretched, when follow-up is uncertain, when risk is present, but it's still invisible. And that is exactly where one of the healthcare challenges exist. Not only in treating disease, but in finding it early, finding it consistently, and finding it at a scale that actually matters. Because by the time many people enter the healthcare system, the problem is no longer early stage, it has already become serious. So how do we build a public health system that acts earlier? Not occasionally, not symbolically, but systematically. Today in many environments, screening still happens in fragments. One device for blood pressure, another for glucose, another for ECG. One staff member records something manually, another tries to coordinate the next step. A report may be generated, or maybe it's not. A patient may come back for follow-up, or maybe they do not. So the issue is not that health systems do not care. The issue is not that our learned doctors do not know what matters. The issue is that in many places, the infrastructure for early detection is still too fragmented, too manual, and too inconsistent. And when screening is fragmented, three things happen. First, throughput suffers. Second, consistency suffers. And third, continuity suffers. And once continuity suffers, public health suffers as well. Manual screening can be helpful, but then one-off camps are not useful as well, because they are not the infrastructure themselves. Multiple devices can generate readings, but readings alone do not create a system. A system needs workflow. A system needs standardization. A system needs reporting. And system needs a follow-up. What public health increasingly needs is not just another machine. It needs a screening infrastructure layer. A layer that can operate in high footfall settings. A layer that can guide the workflow. A layer that can connect multiple diagnostic inputs. A layer that can generate a structured report. A layer that can support continuity over time. That is the space where Kody Technolab comes in. We have developed this robo, Medigo. It's an AI-enabled, on-demand health screening infrastructure for high footfall deployments across institutions. It is designed to bring a standardized screening layer to places where routine screening coverage is inconsistent. By connecting multiple diagnostic devices into one guided workflow and consolidating results into a single report, it enables a repeatable screening programs, faster risk identification, and structured program data. And while I'm speaking about the public health and risk, I'm sure you all are wondering, what's this device on the stage? This is not a gadget. This is not a novelty. Think of it as an health ATM. And I want to emphasize on that. Think of early risk identification and take a moment if it can be faster, more organized, and more scalable. What if the doctors have all the reports available on demand whenever they are with the patient? That is the role Medigo is built to play. So what does it really do? It creates a standardized screening journey. The Medigo workflow includes operator login, patient registration, test or package selection, guided test execution, consolidated report generation, and digital sharing with records available for history and follow-up as configured. That means this is not just a collection of devices standing next to each other. It is a connected process, a guided process, a repeatable process, a measurable process. And that matters because when the workflow becomes standardized, the program becomes scalable. Think of the current public health infrastructure has the information about a possible outbreak or NCDs in a specific area. The officials can create specific campaigns targeted at specific location with a specific measurable input. It's not that they don't have the data, because data is fragmented. And when the same workflow can be repeated across locations, we move from activity to infrastructure. By deploying Medigo at public health spaces such as health centers, Medigo's data will make programs governable. Standardization at scale will improve reliability, and infrastructure will beat one-off camps because repeatable deployments create continuity, coverage, and measurable outcomes. That is a very important shift in thinking. Because in public health, the goal should not be just do more screenings. The goal is to build a system where screening can be governed, tracked, repeated, and improved over time. You all must be wondering that I'm talking so much, but what this device can do. Now, Medigo supports a broad screening suite across blood markers, vitals, diagnostics, and selected AI-assisted assessments. The standard set includes hemoglobin, lipid profile, renal function basics, random glucose, HbA1c, hearing screening, visual acuity, blood pressure, 6-lead ECG, temperature, height, weight, SpO2, and selected AI-assisted eye and oral screening depending on the configuration. And the speed is practical too. Typical end-to-end report generation is around 15 minutes, with blood tests taking around 6 minutes and the remaining tests around 7 minutes. I have my colleague Deep and Umesh on stage. They will operate Medigo and showcase the capabilities. For the record, Medigo has the capabilities for invasive and non-invasive tests. Considering the time we have on hand, we'll be showcasing the non-invasive test. We will test the following: height, BMI, temperature, SpO2, blood pressure, ECG, mental wellness check, and mental wellness has 3 tests: anxiety, fatigue, and stress. For vision, we have Snellen vision screening, color and color blindness assessment. Deep, Umesh, let's show what Medigo is capable of. We will begin with the height. Yeah. Yes, thank you. Umesh, please. Now Umesh's BMI screening will happen. So we have a BMI machine that is integrated with the robo. You can see that it's a complete, yes, thank you. Now we'll measure the temperature. It's taking a little bit of time. Yeah, thank you. That's great. Umesh has a normal temperature right now, despite of being in a demo. Now we are going to measure SpO2. Now we are going to measure the blood pressure. Considering the time we already have, we had Umesh wearing the blood pressure equipment. So you can see systolic and diastolic readings at the same time. I can say my blood pressure is shooting through the roof. Okay, that will be all, and we are going to move now to ECG screening. Umesh, can you please take a seat? so that we can have the accurate reading. Thank you. Fantastic. There you go. Now we will move forward. So this is the report that the ECG device was able to deliver. Now we are going to take the mental health test. Umesh, can you please take this? So this is a multiple choice based questions based on the standard mental assessment test that's happening across the globe. So you can see this is very simple to use. At times when there are no operators available, patients can do this activity by themselves. It's simple to use, just like how we use ATMs on our day-to-day life. You have the mental health assessment on the screen as well. Let's move on to the next test. That's a fatigue assessment test. Umesh, can you please help us? Thank you. So very simple, very repeatable process where if somebody is able to read, they are able to use this on the go, and they don't have to worry about whether they are inputting any wrong information. They can go back and they can go back to the previous screen and use it again. Yeah. Okay, can we go please next? So we are going to do the stress test now. Similarly to mental health assessment, this is again a MCQ based questions. There you go. Thank you. Now we have the Snellen vision screening. So we usually go to our ophthalmologist or our optician to do this screening, and we are able to assess what sort of vision deficiency that we may have developed. This test is on the go, where patients are immediately able to understand and identify whether they are lacking or whether they have a deficiency in vision. Skip this. Now we have the color blindness test. This test is useful for institutions where they are able to do in a high precision environment. They need to undergo this test every 6 to 12 months. And hit submit. Thank you. Okay.
Your diagnostic tests are completed. Take a look at your results.
That was that easy. And powerful as well. because it tells us that this is not only about doing a test, this is about a system that fits the reality of modern public health. Deep, Umesh, thank you. High footfall, distributed populations, limited staff time, need for standardization, need for records, and need for measurable outputs. We are creating accountability and not just automation. Because in public health, success is not just that a test happened. Success means, was the screening recorded? Was the report structured? Was it shared? Can it be tracked? Can it support follow-up? Can the program be measured? That is the promise of Medigo. As per the Government of India and rural health statistics, there are more than 157,000 sub-centers across India. Now, I'm talking about the lowest tier of India's public healthcare system and that form the first point of contact at a community level. They usually do pregnancy registration, antenatal and postnatal checkups, hemoglobin test for anemia, weight and BP monitoring, infant and growth monitoring, immunization support. They also do non-invasive test, non-invasive or non-communicable diseases screening as well, especially into hypertension screening, diabetes screening, or they can refer the patients to the PSC for confirmation. I want to emphasize again, this is not just a robo, this is not just a device, but it's a practical step towards stronger preventive health systems. Kody Technolab Limited is committed for using robotics responsibly, building screening infrastructure intelligently, and helping health systems act earlier, better, and at scale. We are building an infrastructure that can create healthier communities. Our Prime Minister inspired us a decade ago with the Swachh Bharat Abhiyan. We at Kody are committed to carry forward his mission to build Swasth Bharat. Thank you. Jai Hind.